Okay, continuing with the grief and loss, I have to continue with regard to the most important sign of the dealings with loss and grief, which is self-recrimination and self-blame. And again, as I discussed before, the way we deal with grief and loss is extremely important to look at and to see related to our experiences in childhood. Basically, where we're standing when we are a child, what are we the first one, the middle one, the last one, how many children are there, what happened to us between the ages of getting to 5 years old, which I believe is basically the nidus for the build-up of how we perceive and how we deal with our environment. And there are a lot of varieties with regard to the losses, especially children of war, children of traumas happening to them with regard to their sibling dying, what age they were, people who were coming from war situations, basically at a certain age, ages of 3, 4, 5 years old, they experience the loss extensively, and there could be possibilities of feelings of guilt, remorse, anger turned towards themselves, and at times turned towards the object world, which causes destructive behavior and basically deal with that loss. Now, the anger at times becomes a main representation of the dealing with the loss, which can continue throughout the lifetime of the individual, and by itself could be seen as a protector and unfortunately destructive process, because of the anger that is going to be projected into our lives and dealt with people around us, which causes problems with isolation, with adding up problems related to perception of the world as hostile, with problems related to management of daily life, dealing with loved ones, dealing with work, dealing with a wife, dealing with a husband, dealing with a partner, and mostly build up the character. And unfortunately, if that continues and it's not dealt with, which is the anger, it could be very destructive and withholding of a person with regard to how they progress in their lives. Now, mostly the treatment of this grief and loss is basically, first of all, we have to have a environment to be able to express our feelings. Group therapy important, support system is important. Letting the expression of the anger and emotions and guilt and frustration to come out, and how a person goes through the phases of grief and loss, with first denial, then negotiation, then anger, and then establishment of acceptance and depression, which has a phase that the patient and person has to go through, which has to be dealt with. And if all this is being taken care of, not in these 5 minutes that I'm talking about, but basically more extensively dealt with, it would be very helpful to how to we deal with loss and grief in our lives. Thank you.